For me, mental health is about recognizing that my state of mind is just as important as my physical health, my social well-being, giving myself the time and space to acknowledge my feelings, to sit with them, to truly process and validate. And it's about continuing to do this over and over, just the same as we spend this time on our physical health.
As a physician, I was taught to keep an emotional distance from patients until I fought my way through postpartum anxiety that was so vivid and terrifying that I now actually feel compelled to share it with some of my postpartum patients. When I see them in clinic and they're brave enough to admit that life with their newborn isn't all sunshine and rainbows, I ask for permission to give them a hug, and then I share my story. I disclose that despite my training, I did not recognize postpartum anxiety when I was going through it with either of my children. I tell them how I passed all my postpartum screening tests, lying because I knew what answers were expected. And then I tell them about the pain and horror that I suffered for 2 years of my life, because I want them to see that it is common, that it can affect anyone, that they too will survive this, and that they don't have to suffer in silence the way I did.
Mental health is being mindful of my anxiety and stressors related to CF. It means I take an active role in my child's care, but also understand there are aspects I cannot control, and find peace in knowing I'm doing everything in my power to ensure my daughter thrives.
Mental health is seeing a psychiatrist and a therapist to deal with the trauma of being slowly destroyed by a chronic illness and of going through pain and fear from a young age. Mental health is being able to share with medical professionals that you are sad a lot, that you think about dying a lot, without worrying that it will affect my care in a negative way.
As both a CF and an ICU doctor, I continually play a part in human suffering, death, truly painful and awful situations, and it still gets me where it hurts every time. But the sorrow and pain I feel are merely reminders that I have not yet lost that part of myself. Have no shame in tears. Seek support from your colleagues and provide it in return. Recognize when you are empty and take the time to refill. Don't be afraid to connect with your patients on a deep level. Not only do they need that connection, you need it too.
At the beginning of COVID, when everything shut down and there was so much uncertainty, we were all working from home. My kids were doing school from home. My husband was teaching 5th grade from home. And I remember talking to my patients who were scared and uncertain and worried about work and money and health and everything, and feeling like I had no idea how to support them because I didn't know how to support myself. I started an antidepressant for the first time in my life, and it really helped. It helped me get through that time. But it's still an ongoing challenge, and trying to be okay with that and know that that's okay, and that's, just part of life and always will be.
Mental health is health. It exists on a spectrum, and it can move along that spectrum depending on what's going on in our lives. When my mental health is good, I'm able to be a really present and patient mother. I'm a supportive partner to my husband, a sensitive yet boundaried friend. When my mental health is suffering, I'm unable to show up as my full self. Not for lack of wanting to, but like having a broken arm limits your ability to function, so does impaired mental health. Mental health requires patience, care, and attention, just as much as other kinds of health.